America has a drug problem. Prescription costs are rising faster than inflation thanks to an unscrupulous pharmaceutical market.
A lot of what's going on in the drug space is not transparent. We don't have a free market in the drug business in this country, so we don't have those free market forces that regulates cost.
Paul Seegert, managing partner of PCS Advisors, helps companies get the most out of their pricey health plans and shows us what's driving these skyrocketing costs. He's offering options that can save all of us money. Let's start with the traditional health plan model. Over 155 million of us use them, and they have one thing in common: massive price hikes.
They do it every 6 months. You have the pharmacies. They inflate the cost of generic drugs, and then you have pharmacy benefit managers. They manage the formulary for health plans.
Paul says the original intent of the pharmacy benefits manager was to advocate for lower prices for consumers.
What's happened, though, is they've been allowed to operate without transparency, and they've invented more and more fees that they layer onto the cost of drugs.
He says instead of helping us, they're driving up the cost of healthcare across the board.
They can add 30, 40, 50, 60% to the cost of drugs. We may not always see it as a consumer because we're just thinking in terms of our copay, but it drives a lot of the increase each year that we see in our premium overall.
And if you're thinking of saving money by paying cash at your pharmacy, well, think again.
It really boils down to how we pay for this stuff. We use insurance. And if you're a pharmacy that takes insurance, you're not allowed to determine your own cash price for a drug.
Which leads us to the next item on our list: cash-only pharmacies like Mark Cuban's Cost Plus Drugs.
What he's done is break free from the control of the insurance payment model because he doesn't take insurance.
Ditching the insurance company can save upwards of 60% on many common generics.
He's working to make it more efficient, going directly to the manufacturer of drugs, buying the drugs, and turning around and selling them directly to the consumer with a 15% markup.
Paul cautions that if you buy through a cash-only pharmacy, you aren't paying toward your deductible, and you have to factor in $15 for shipping and a dispensing fee of $5 per order.
So you just want to look at it globally. Does this make sense for me or not?
Most people have no idea that drug prices vary.
We'll wrap it up with free discount cards and drug lists. You've no doubt seen the commercials for GoodRx, which Paul says is one of the more popular cards.
So what GoodRx is doing, not only helping you do a geographic search of where is the best pricing on the drug, but they can also help you if there's a coupon that's available.
Optum Perks and RX Saver offer similar benefits, and Paul says you'll also want to check out the $4 drug lists from places like Walmart, Kroger, and others.
That can be a very good solution if you're taking generic drugs. You don't realize it. You're just going down to the corner pharmacy and paying your $20 copay when you could be getting the drug for $4 or $5.
Fighting back against drug piracy and winning the pharmacy war is at the top of the list.